Jen, what's in that prone pack?
Hey Jackie, this prone pack is pre-made to help you manually prone your patients easier. It's like one-stop shopping for all of your supplies. So let's talk about what's in it real quick. You've got 4 pillows. You have pillowcases to go with that, as well as a couple flat sheets so that you can utilize that while you're turning your patient. You will have the gray slidey sheet in there. If you don't already have one under your patient, sometimes you can use 2, so having that extra one in the pack will be very helpful. You'll have the Comfort Glide chucks to use underneath that, as well as a pre-made little bag with EKG electrodes for putting on your patient's back after you've prone them. Hemostats just in case respiratory therapist needs them, and hair ties for your female patients who have long hair.
Or male.
Or male, thank you. Any patient with long hair. You will have a smattering of different Mepilex and Alevins for padding bony prominences. So don't let these 2 fool you. There are additional ones in there with various sizes. And last but not least, we have this wonderful headrest pillow that has come from the OR. They've had great success in proning their patients down in the OR with this. And when you open it out of the pack, it will expand to this. So white side goes towards patient's face. It has a slit in there so that you can redirect that ET tube. We did talk about maybe using one of the pillowcases to cover this just to help absorb secretions and things like that. And the other thing that this pillow allows for, once the patient is prone, is storing their head to the side of the pillow and then being able to lift, remove the pillow, turn their head the opposite direction, and flipping. So that way we are preventing skin breakdown as well as letting their neck stretch out. So that is what's in your prone pack.
Thanks so much, Jen. Hey Jen, how do you manually prone a patient?
Hey Jackie, first you have your patient in the bed. We have already positioned him on a gray slidey sheet, which was part of that pre-made prone pack. It really helps with the assistance of turning. You've got handles on the sides, all of that good stuff. We have prepped him by placing Mepilex and Alevin dressings on all the bony prominences that we feel need to be protected the most. And we have prepped a pad in the bed for when we turn. We're going to be tucking our new draw sheet underneath. We've got at least 2 other nurses with you to help turn, just for simplicity. Obviously, if you have a patient whose body size deems that you should have more people, safety first for our staff. You've also got a respiratory therapist at the head of the bed who is going to help manage the ET tube and head during this whole process. So this is our pillow that we will be using today. And we're gonna hopefully get it underneath him nice and safe. There we go. All right, so first things first, we're going to scoot him towards the head of the bed and towards my side, starting the turn process there. All right, all ready? On 3. 1, 2, 3. And I think we can come just a little bit more on my side. Okay. And we're just getting him ready. Mm-hmm. All right. You ready to turn? Lynn, everything's good on your end?
Everything's good on my end. We're going to keep his head supported and just kept to his right.
All right, on 3. 1, 2, and 3. Come on over. Pull this and take it like this. And you want to make sure you pull the patient's arm out from underneath him. since he is paralyzed and sedated. All right. So why don't we come towards the middle of the bed a little bit, and then we can help get him in a better position for tucking that pillow. Can you manage his head a little bit, Lynn, if we just come towards me? All right, on 3, we're just going towards the middle. 1, 2. There we go. All right. Now we're gonna have to help come to the head of the bed, bring his head off of the bed, so we can tuck this pillow. Are we decided we were doing? Okay, are you ready? We're gonna come up. 1, 2, 3. Be supported on this.
Our patient's moving.
Oh, sedate him more. All right, and now we're gonna come up a little bit and then back down. 1, 2, and 3. There we go. So it does look like his shoulders need to be supported a little bit, so we've got some extra pillows here that came in our prone pack. We're gonna try to turn him towards me and tuck those pillows as far as possible. Upper chest as well as hips, leaving room in the middle for his diaphragm to move. All right, ready, Liz? On 3. 1, 2, and 3. All right. And let's
Gotta
see.
push him a little farther.
I think just one. Let's just try one. You ready? Coming back down. And if y'all can help, just give me a little bit of. There we go. There's that pillow, and here's this one. We'd also be adding a third pillow under the shins. But right now, I just want to make sure his shoulders are supported. So you can accomplish this by doing towel rolls under the shoulders. They do that in the OR. Or you can use a bath blanket that's rolled up. Depending on the patient's size, you may have to think outside the box to help support those shoulders better. Another thing that we want to do though is we're going to swim the arms up over the patient's head to help support. Quit moving. You're sedated. And that way he can breathe easier and it should be more comfortable on the shoulders. You would want to add doing some range of motion with the shoulders periodically throughout the day just to help the shoulders from freezing up. Last but not least, we are going to replace his EKG electrodes on his back, just like you would in the rotoprone bed. That way he's not laying on his heart leads in the bed. Okay.
Thanks,
That's how
Jen.
you really prone your patient.